Mike, congratulations on assuming the presidency of ASAPS. Would you please share with us your top 3 goals for the next year?
Thanks, Dr. Nahai. The things that I think that are important to promote in my next coming year as president, which I'm sure will fly by, will be to continue to promote ASAPS as the go-to education source. After all, we are aesthetics for both our membership and also the patient population out there. I also really want to focus this year on trying to get more residents involved and getting us more involved in educating the residents in terms of aesthetic medicine, because it's important. That's what's going to formulate a good portion of their future practices. And lastly, I think the importance of getting women involved in our specialty is even more important. And I mean at all levels, committees, councils, and leadership as well.
Dr. Stevens, you've always been on the cutting edge of aesthetic surgery, always ahead of the curve. What can we expect as the next new innovation?
Well, thank you very much for that compliment. I certainly have been involved in non-invasive surgery and trying to stay up with the technologies of advancing aesthetic surgery. I think when we look forward to the next decade, we're going to see further advancements in non-surgical body contouring and non-surgical facial rejuvenation. I think we'll also see some advancements in robotics and minimally invasive surgery. I think we'll be doing more with endoscopic surgery and smaller incisions and shorter recovery times. I think the field of cryolipolysis and using cold to adjust the body contour is just beginning. I think cold will be used for acne and for other skin tightening devices, so that we'll see a further advancement in cryolipolysis as a way for beautification, non-surgical beautification.
Jack, you've just finished a very successful year as president of ASAPS. What did you learn and what's next for you?
Well, I certainly learned, Fuad, what a wonderful organization ASAPS is. It's really been a remarkable year for me. I think I've grown as an individual, but also I've been surrounded with really wonderful people. Not only those on the medical side, my colleagues, but also the staff of ASAPS. They're really a remarkable group, and I've had a great time. As far as what's next, obviously I'm going to stay involved in the organization, but this will free me up to do some other things on the education side, which has really always been one of my major interests as far as my involvement in ASAPS. I really enjoy what we have accomplished over the years in education, and I think we have opportunities to take education to the next level. And so I hope to be part of that evolution to the next generation of how we can teach better, and especially our legacy in how we can take the residents and fellows and make them better and safer plastic surgeons.
Lori, you're one of the leading female aesthetic surgeons. Tell me about your favorite operation and how it pleases your patients.
I think the postpartum woman who comes to me after having children, and they are the love of her life, however, her body has undergone changes that she's just not happy with. So a mommy makeover starting with breast work, usually from a deflated breast, and some excision of skin in a tummy tuck after great muscle work. So just working with women after having babies and feeling like they just want to restore their previous body shape.
Julius, you're a recognized expert on non-surgical rejuvenation. Please tell us your philosophy of producing natural appearing results and how that relates to your position as Commissioner of Cosmetic Medicine for ASAPS.
Well, I think that the real key in producing the most natural and aesthetic result is, frankly, subtlety. So not overdoing, not overcorrecting, I think is the cornerstone. And my general philosophy, especially as it relates to the non-surgical approach, whether it be fillers or neurotoxins, is to really emphasize with my patients the goal of anywhere from 85 to 95% correction. I think that this really has produced the most natural results, and it's frankly what I think most people are looking for. And anytime I see somebody out and about in a social setting where they have sausages under their eyes or lips that look like duckbills, I think it does the specialty a disservice. So I think youth and a healthy appearance really is an understatement. It should be.
Jeff, you've made many contributions to aesthetic plastic surgery, and you're recognized as a leader and investigator in looking at the science behind the non-invasive modalities for facial rejuvenation. Please tell us where that research is going and what we should expect in the future.
Yeah, well, I think we'd be naive to think that this isn't going to be an important part of our practice in the future. The demand is out there. Patients really want non-invasive alternatives. I think the challenges that we've had have been reproducibility and predictability. So as we go forward and as more and more companies become invested in this area, we have to kind of hold their feet to the fire and demand not only good data but reproducibility, because it's very hard to sell patients on technology if it's not reproducible. So consistency and reproducibility is going to be very important in the future, and I still think that this is a wide open area, and we as plastic surgeons have to be part of it, because we're a unique group because we can offer our patients the spectrum of treatments from non-surgical to surgical.
Renato, you've been involved with the journal as an author, a reviewer, and more important, as chair of the publications committee. So please give us your vision for the future of ASJ.
Well, forward as a plastic surgeon, aesthetic surgeon, as a member of the society and chair of the publications committee, I couldn't be happier with the ASJ and all the work you have done with your team of editors and staff to really make the Gold Journal the gold standard for aesthetic surgery in the world now. I see ASJ continue to grow. I see ASJ in every country that I visit at meetings. I see our international colleagues publishing. I see our national colleagues looking at ASJ as the standard for aesthetic surgery. So I'm very happy with our journal. I'm very proud of ASAPS and ASJ.
Jim, for several years you've put together a very, very successful annual program for ASAPS. What has been your greatest challenge in putting together a program?
It's a great question, and I think from my standpoint, the biggest challenge really was trying to always up the ante, if you will, to always try to create a new meeting that was exploring the newest issues, the newest techniques, and try to up the quality of the meeting every year. The responses that we get from attendees of the annual meeting are always interesting to look at, because we hear things like you have some of the same speakers every year, and that is true, but we have some really top-notch educators in this specialty, and my challenge was to create a topic that could extract and get them thinking about the very latest things that they were doing and sort of push the envelope as far as the area of expertise that they had. So that was my greatest challenge.
Graham, you practice in Melbourne, Australia. You're affiliated with Monash University. You have an aesthetic fellowship. Tell us about your experience as a role model, a mentor, and teacher of the next generation of aesthetic surgeons.
Well, I've had over 50 fellows now, and it's over 20 years experience, and I think it's taught me enormously that it's such a privilege to be in this position, to be able to contribute and give back. And I think it's amazing to see the standard of the aesthetic plastic surgeons that are coming through for our future generations. And I look on them a little bit like my own children. I think it's wonderful to be able to spend time with them, get to know them at a very personal level. They challenge you, they produce wonderful, I think, improvement in your surgical and your consulting techniques. and they take with them perhaps a little bit of what I've experienced over many years. So it's giving back to the profession, which I think is very important.
Claude, you practice in Montreux, Switzerland. Please tell us, what is your patient's major concern when they first come in to you for consultation?
Well, to be honest, the question that they ask is, or that they ask very soon is, how much does it cost? But honestly, I don't think this is their main concern. Their main concern is it safe? I am a mother of 2 small children. Is there a danger for my family if I undergo aesthetic surgery? But in a way, they sort of just assume if they come to a Swiss surgeon, safety should be guaranteed. But sometimes we have to tell them that it is a procedure, that there are certain risks, that we're doing the best, that we are trained in practicing safe surgery. And it's good for them to know about this, because it is truly an issue, and it's an issue for us too. We have to do everything to make our surgery and whatever we do not a dangerous business, but a very safe business.
Patrick, congratulations. Your colleagues and you won the award for the Best International Paper in ASJ 2013. You've always been a contributor. You've reviewed for us. What can we expect in 2014?
Well, thank you. We're very happy and proud with this award, Alex and I especially. I think we're going to work further on the idea of correcting the deflation in the face, as we start to realize that the lifting procedures only correct the sagginess in the face and only work in the peripheral part of the face. And we start to realize more and more that deflation in the central part of the face is getting more important than the sagginess. So we call this now central facial rejuvenation. That's all the work we do around the eyes, the mid-face, around the mouth, and it starts to become more and more important in the concept of a total facial rejuvenation. So I think that could be the next article.
Clark, I know you do a lot of complex cases. Tell us about one of the recent complex breast cases you've done where things weren't exactly what they seemed.
Well, I think the two things that always raise the bar with breast cases are aesthetic breast cases, where you have the challenge of a patient who's otherwise healthy, who's just looking for an aesthetic improvement, combined with a revision case. So I can think particularly of a recent aesthetic revision case that I had to pull out all the stops that I've learned over the years at these meetings and from the journal, including a neo-subpectoral pocket, use of an ADM for additional support, and thankfully, so far at about 4 months post-op, seems like things are greatly improved. She's very happy with the results, and I have you and your organization to thank for that.
Michel, you are the president of SOFCEP, the French Aesthetic Society. What do you see as the biggest challenge for you as the president of the organization?
I think the most important should be to maintain the high quality of patient safety in our country. And of course, Europe permits to share the surgeons between different countries, and the high quality in France of plastic surgery is very, very nice, very high level. So we have to maintain absolutely this high quality.
Jason, as someone who's about to start his career in aesthetic plastic surgery, tell us what you see as your challenges setting up your practice.
Where do I begin? You go through your training, and every day you're used to operating and having the patients just ready to go for you, and then all of a sudden the next day you got to figure out where to get your patients from. And I'm from Los Angeles, and there's a lot of great surgeons there and a lot of competition, and I think it's a difficult problem to try to figure out how to attract aesthetic patients, especially when it's an elective procedure with a lot of options out there.